I want to quickly run through the speakers that you'll be hearing from here this morning, and then I'll turn it over to Mayor Rick Blangiardi, of course, is joining us. Ian Santee, I mentioned, is the Deputy Director of the Honolulu Emergency Services Department. Dr. Dan Kehoe from North Shore Mental Health is joining us, along with Sean Sanada, who's the Chief Administrative Officer here at Lēʻahi. Also joining us is Sam Moku, the Mayor's Homeless Coordinator, as well as Anton Krucki, who is the Director of the city's Department of Community Services. So with that, for some opening remarks, I'll turn it over to Mayor Rick Blangiardi.
Thank you. Good morning, everyone, and thank you for being here. This is another example of a collaboration with the state. You know, we really, in Iwilei, turned over our respite center there that the city had built, and it's currently being used. And this was really sort of an exchange thing because, quite honestly, we needed the beds. We needed a place to be able to take people, and you're going to hear from a tremendous array of speakers. I don't want to take anything away from that. This is just yet again one more effort, a really key strategic effort in how we're treating our most severe homeless patients. And I think you're going to hear some real encouraging strategy, if you will, this morning from the speakers on how this is going to work. We're very, very excited. This is really an opportunity to take people really who have nothing and to bring them into a place and give them everything we possibly can to move them along to supportive housing, including birth certificates and IDs and everything else beyond their medical treatment. So I'm anxious to hear what our speakers have to say. I thank you for being here today. I want to say it again, great collaboration with the state and one more effort on our part to deal with our homeless population.
Again, Ian Santee, Deputy Director, Honolulu Emergency Services Department. The collaboration, as the mayor mentioned, again, is involved both the State Department of Human Services, the City and County of Honolulu Emergency Services Department, Department of Community Services also, and the Hawaii Health Systems Corporation Hospital, as well as North Shore Mental Health. Again, through CORE, our Crisis Outreach Response and Engagement is the mayor's priority for homelessness, addressing homelessness in the City and County of Honolulu. We created a partnership and collaboration with all these entities to support the funding, to support the resources, and to get clients over here. The clients over here, and I'll let Dr. Kehoe go a little bit more into that, but the clients over here are either through a hospital discharge or through collaboration by our staff at CORE. The clients here all have some type of medical condition that cannot be treated on the street. A lot of the times, individuals that are houseless, that are found on the street, they get some type of wound care, and they get it in the emergency room, and then they go back to the street. What that does is, when it gets infected or when it gets out of control, it increases the 911 calls, and our 911 calls for our ambulances are picking them up and taking them to the emergency room, causing some overcrowding. As we all know, the homeless issues that we have faced out there is we need to get places for the individuals so they can get the services that they need. So an individual found on the street or found in the hospital that has some type of medical condition that needs to be addressed is facilitated through a referral program over here. And we work with North Shore Mental Health, and they do have case managers on their own to facilitate the needs of the paperwork that the individual needs to get into some type of housing program or the services that they need. So again, this is a collaborative effort between the whole city, the state, and North Shore Mental Health. And I'll let Dr. Kehoe talk next.
Thank you, Ian. Forgive me, I did prepare, and so I have a little bit more paperwork going in front of me, so I may read a little bit, but I hope you understand that. It's our privilege at North Shore Mental Health to provide services at the Lēʻahi Behavioral and Medical Respite Facility for chronically homeless people here in Hawaii on Oʻahu. This establishment through the door here is with a 20-bed facility. It is 24/7, and it is directed daily by Kama Tam, who's quite an accomplished therapist and has been doing a lot of work for us in the past with the COVID hotels. So she's very qualified, and also as a substance abuse therapist. We view our patients here as an endeavor to help provide for our neighbors, our citizens. A lot of people do not have the experience of meeting or seeing a lot of the patients that we serve, but these are our fellow citizens. These are our fellow neighbors. These are neighbors to all of us in the community of Oʻahu. And I want to remind everybody of that, because when you get to work with your neighbor and you see the needs they have, it's a dedication from excellent leadership that brings services like this forthcoming to take care of often people who are not seen or taken care of. So we appreciate greatly the Honolulu Mayor Blangiardi, Dr. James Ireland, who I don't think is here today, but he has a lot to do with what we've been doing about here today, and Deputy Ian Santee of the Honolulu Emergency Service Department. These are the people these people and this mayor have not forgotten these people, and they have gone out of their way to take care of them and provide services like this. Most people won't see it. I guess now on TV they will, but for the most part, they haven't forgotten our fellow neighbors. Over the last several years, I've had the experience, because we generally have hundreds and hundreds of patients, that we've seen a lot of people come out of the emergency rooms in the hospitals on the island in the past, and they've had nowhere to go. Literally nowhere to go. Sometimes, as they would say, to the curb. So this particular facility is changing that. This particular facility is allowing people to be treated as humans that need services, who need care and need help. We're so privileged to be able to provide that. We appreciate that very much. Uniquely, when these people are discharged, this is so different now, because we have vehicles and we coordinate the discharge planning so that we literally go to the hospital and pick them up rather than having them just out the door at the ER room. So our vehicles pick them up, they bring them here, and we take care of what they need and they assist them. Uniquely, and this is very unique by the way, these citizens do not have to have health insurance to be seen or assisted. That's dramatically different. Thank you, Mayor. Upon admission to the Lēʻahi facility, our staff focuses on 5 significant activities to stabilize and provide for our needy neighbors. These 5 areas are what we spend time with every single day. First of all, we tend to work primarily to stabilize their physical health. So physical health is a commodity here. We have psychiatric nurses. We have 100 case managers throughout the island. We have almost 50 licensed providers. So we have a really coordinated effort of follow-up when they leave here. They don't leave here until we have them in the services that they need. That's different. A lot of times in the past, things were timed, X amount of days, X amount of perhaps a month. That's not the case here. The case here is we take care of people until they have their services in place and stabilized, including medical stabilization. We have psychiatric nurses, we have psychiatrists, psychologists, licensed clinical social workers, we have substance abuse counselors here. We have a variety of professional people who are licensed and recognized in their profession. Our second emphasis is mental health, of course. Licensed people who are there to take care of their needs, including substance abuse, which is one of our other areas of emphasis. Our third area that we specialize in is housing. We now have a wonderful community entry system, which we lock into, and we get people placed, and we make sure they have a house to go to and a home to be in. Number 3. Number 4, substance use disorder treatment. We have 8 CSACs that work for North Shore Mental Health. I know that may not seem like a lot to you, but actually that's a good number. That's a substantial number. And so we are able to provide IOP treatment right here at the facility. We're able to follow that up so that people get the care they need if they have addiction issues. So again, that's another service that we supply. And our 5th area of activity is for Division of Vocational Rehabilitation. If the patient's capable of being able to train for vocational training, then we are coordinating them with that. So with our vehicles, we're able to take our people out to the appointments they need. If they don't have appointments that can be facilitated here, then obviously we have them right here. The doctors come into our facility, our psychiatrists especially. So the vocational training is also provided and also very much needed and highly supported, again, by the great leadership we have in developing this program. I want all of you to understand that we do appreciate the opportunity to take care of our fellow citizens, our fellow neighbors. We're here to help other people. We've been given the privilege of being able to do that, and I want to thank everyone who's here today, but also especially, again, the leadership that provides us to provide what we know how to do in a facility that allows us to offer it. Thank you so much.
Good morning, everyone. Throughout its history, this campus, Lēʻahi Hospital, has always been a place of refuge, a place where safety net services are provided for the community to the maximum public benefit. Over the past several years, we've had a lot of encouragement and support from the state legislature, to maximize the use of this space. That being said, it makes me very proud of this project and what it's become from when we first had our initial discussions. As mentioned earlier by the mayor, this is a collaboration between the state hospital system, the city, EMS, Department of Human Services. All these parties combined created this program, and it's been very successful since its onset. I can say that this is just one example of how collaboration works. When you put different minds together from different areas of government that are all committed to the same cause, a good cause, what can actually happen for the community. We're very proud that the population that this program will serve will not only benefit the people who are in the facility, but also people in the community, because you have less people occupying the ERs. You have less people, I guess, worried about the homeless in the street. When we evaluate a program, we look at it not just for who we serve, but how it serves the greater public. And we're very happy that from our initial discussions a while back, everything developed pretty cleanly, and we opened with not too much fanfare, but the impact of all of these operations have been profound. So, once again, I think this collaboration works. We should keep doing it in further projects, and we're just glad to have been a part of this one. Thank you.
Good morning. Anton Krucki, Director of the Department of Community Services. This program is not just an event, but it flows right into the strategy that the mayor and the city have for addressing homelessness on our island. As complex as homelessness is, it really is about two items that we have to constantly deploy. The first is we have to be able to work with individuals that are homeless to get them to engage the system. All the different creative things that we can do. And this represents one of those creative items, and the Crisis Outreach and Response and Engagement team and the team that's inside represent that kind of draw that can bring people in, bringing them directly from the hospital ER into this facility. The second part of that strategy is constantly analyzing our resources to service those decisions. So when people come in here, do we have the resources to deploy? So I would tell you that over 20 people already have been taken off the streets that are being serviced here. And this will be one event that will fall into a series of events that fall into that strategy. What can we do to get people to be willing to engage the system? And then what resources can we bring to service those decisions? And we're really proud of this event today. And I think the best thing is when you meet the individuals that are serviced here, that the journey that they're on is such a positive one. Thank you.
Sam Oku, Mayor's Homeless Coordinator. I'll just kind of pull everything together. Our partnership with the state, and John Mizuno and I have been coordinating a lot of different types of beds of many flavors that Anton failed to speak about, which he loves that saying. But these beds of many flavors, this is one of the important beds we need. The medical respite. The medical respite is an important part because these homeless that are on the streets need that type of help. And so John and I are committed, John Mizuno and I are committed to make sure that we have more shelters that provide medical respites across the island. And one last thing I want to say is, you got the state, you got the city, we got resources, we got our resource base, which is our service providers, but the most important part is our communities, because we will be coming to your community somewhere to build one of these shelters. And I ask all of you to be supportive. Thank you.
Thanks. And before we open up for questions, I just want to summarize it in a way, because we've been talking and living with this for a long time. So it starts off, there's really three components to our strategy. And the first one starts with our mobile crisis unit, CORE. Our ability to take healthcare workers, put them out in the street, to build trust, relationships, and even provide some medical care. But the ability to pick up people and take them without having to deploy EMS, which is already overburdened, or even HPD for that matter. Having that mobile crisis unit is really important. Having facilities to take them to is also what we've been about. And the city owns some facilities, other things that we'll be announcing shortly, which we'll do. That's one thing. But the X factor, and this is where our shout out goes to the North Shore Medical Group, and I really loved everything that Dr. Keogh said this morning. That army of workers, that capability, those skill sets to provide real care for people really in deep need is the X factor. And now we feel that those pieces are starting to come together. So it's really that combination of having a mobile crisis unit, facilities that we can take them to, we know they're going to get care, but the real X factor, as I told Dr. Keogh this morning, kind of the secret sauce in this whole thing, is having the professionalism of a group like North Shore Medical Group and other services that we'll be sharing with you. That's what we're really excited about, because in return for that, our expectation here of transforming these people and helping them with their lives to the best of our ability is very real. So with that, we'll open it up to any questions that anybody has for all the other people. Go ahead, Ian. I know you want to ask something.
When did this open? When is this particular project?
Derek, what was the actual? We were here months ago in the planning stages. Okay, Ian's going to come up. Okay.
March 6th, right? So again, this opened on March 6th. So the initial clients were brought in by CORE and a collaboration with referrals from the hospital. So back in March, we've been open since then, 24/7, 7 days a week. And it's just been a slow uptick of the clients at that point.
And how many clients are there?
Currently today, there's 17. As Director Krucky spoke about, we've had about 22. 5 have been discharged in various forms or relationships with either housing, or they chose to get out on their own, or one person actually returned to the mainland.
These are all homeless?
Yes, every individual in here has been houseless.
Is the city trying to reconnect them with families?
Yep, so working with North Shore Mental Health, we do work with the collaboration of children, reconnect either with family first or finding them services that they're able to do on their own.
And how long are they allowed to stay?
There isn't a time limit per se, but we try to find, our goal is within 30 to 60 days, about 60 days I would say, is about the time. Yeah, we want to move them along as fast as we can, but we cannot hold them. We're not going to just kick them out and put them back on the street.
And do you know how many patients you've had since March?
22.
20.
Yeah.
Total?
Total of 22.
And how much is the city spending on this?
So the city is not spending any money. This was a grant received from the state and Department of Human Services for $4.2 million to collaborate with North Shore Mental Health, as well as to collaborate with the city's CORE program.
This is a state grant.
Yes.
And how long is the project going to last?
The project's going to last. We're looking for actually other funding to continue the grant, so we're hoping the project will be going as long as we can.
Did Mr. Morgan mention that there's going to be other sites
I
around
would
that?
defer to the mayor and them to talk about that.
How many sites?
I can't tell you exactly how many sites, but we're going to do as much as we possibly can. You know, money is somewhat finite, but this is where the collaboration with the state comes in, because, you know, the state has the Department of Health. They have access to funds, federal funds as well as state funds, and this is where I think our working together really makes a difference. So we're going to be making another announcement very soon that's actually pretty aggressive, and that we're really excited about. It also involves a team of physicians, but I want to say it again. Our homeless population right now, as we estimate, that's out there, that's really in serious need, is probably more than a couple thousand, based on the point in time count. I'm talking about chronic homeless that have been out there that we know are suffering from, well, not only long-term being out in the street, but, you know, addictions and mental illness. And that's going to take a number of facilities to try to address that. But I think, as Ian said, and I want to make this point clear, it's a transitional facility. So while there's no timeline, as Dr. Keogh said, our expectation here is to make people better and to move them out and to get them into more supportive housing. Okay?
Transitional housing is
Transitional housing?
So since January, we've laid out a plan for beds. Like we've said, we need beds of many flavors. Some of those are the transitional housing that you're asking about. Some are medical treatment. Some of it's permanent housing, right? right? So we have different types that we're highlighting as we go. And right now on the drawing board, to be deployed in 1 year's time since January 1st, so that's between now and the end of the year, is close to 800 beds. That's a lot of beds to be putting in and working. But the important thing is they need to be beds that work. They need to be beds that the person wants to gravitate to, and a place that service why they're coming in and can be successful beds. That's what we're really focused on. But that's a lot that we're trying to bring on into the system this year.
Like you said, beds that people want to gravitate to. Any particular locations that are overwhelming priorities in the months and years to come? For
Well,
a similar facility like this?
Yes, that's a great question. You were talking about areas that they gravitate to. Some of our most populated areas for homeless are up in the Waianae coast, and so we're working on beds in that space. But the urban core is where most of the services are really needed. We do, but we have beds opening up in multiple areas. Like in Wahiawa, we're opening up with Family Promise, in a partnership with Family Promise, a shelter up there for families. Hauula, we're opening up a partnership with the state where they'll be soliciting for people for family shelters up there. So not only are we looking at these events, but then where do people graduate and go to from there? So we're trying to make this a coordinated operation so that people can be successfully put in places or be in places that are successful for them. It's a journey. It's not easy. It's difficult for them. It's difficult to provide those services. But together, I think we can do that. And with the help of the individuals in the journey, they're part of the success factor in this as well. So that's what we're deploying.
I want to add something to this as well. This is on a personal level for me, but we can't create enough of a sense of urgency. You know, people suffering on the streets is not acceptable. I've said countless times, the street is not a home. Quite honestly, we're a little bit behind schedule on where we wanted to be, and candidly, the governor and I were really pretty much targeting Labor Day last year as a launch for some of the plans that we had in the collaboration, and then everything got derailed in August with Maui. So we can't act fast enough. I just want to say that. So we're going to be coming at the media with hopefully a number of different stories here. We're being very aggressive with this. I think it's something the public wants to see, but more than anything, my feeling is, and the compassion for those people who are suffering, we need to be able to bring them some help and be able to reach those folks. And that's what this is all about. Okay? Any other questions? Yes, ma'am. Who are you?
Oh, I'm Summer Science from Hawaii Sound.
Hi.
Talking about the success of the journey that your patients have, or hopefully have, how do you follow up with the released patients to ensure that they are actually healthy once they leave?
Okay. So I'm going to defer that to either Dr. Keogh, if there's a follow-up on patients that get released, or if somebody else wants to answer that.
I'm sorry, I didn't hear the question.
How do you follow up with the released patients once they left the facility so
Good
that
question.
they're healthy?
Very good question. Yeah, that's an excellent question, because as we've seen in many other states, they'll often take people and put them in hotels and places of this nature, and 30 days later, no one knows what happened to them. So this particular program allows us, as I mentioned earlier, we actually have 100 case managers on this island. And they're located geographically out to Waianae, Makaha, Kahuku, Kaneohe, here in town, obviously, Central, Aiea. So we have we have 6 offices throughout this island. We have 100 case managers, 50 of them are licensed. We're locked in with 1,800 patients at the present. So we have a system already in place that follows up. We have a system in place where they transition perhaps maybe away from this building, but they would then perhaps be, and this is our charge, to get them into one of the 2 case management systems. The primary system currently through Medicaid is through the Department of Human Services, Community Care Services. That particular program, I understand, has about a few thousand patients. We're responsible for about 1,800 of them at the present. The AMHD system, the Adult Mental Health Division, is the other case management system. So to answer your question, the follow-up is to place them into case management. So if we now have them in a housing coordination that's good for them, we also have our continued case manager involved, making sure that they are attending their appointments, making sure that they are still taking their medications, making sure that they still have an opportunity to receive therapy, substance abuse issues, whatever it is that they need. We have the mental health staff to provide it, from psychiatrists to substance abuse counselors, as I mentioned earlier. We have 5 psychologists on the island. We have multiple psychiatrists. So the system's in place once they leave here. It's just called case management or community care services. In the adult mental health division, it's called case management. Okay?
Thank you, Dr.
Sure.
And one last thing here, just to make sure we wrap it up the right way. In an effort like this, there are many unsung heroes. There are a couple of groups here today. I just want to make sure we recognize, first of all, the people in the red T-shirts are members of our core group. You know who Ian is, and but the work that they do, that doesn't get chronicled, it's not watched by the hour, is miraculous kinds of stuff out there, establishing contact, building trust, and really deeply caring for people. I also want to give a shout out here to North Shore Medical Group, Kama. I was going to say Market, Kama, right here. This lady right here is going to stand in the shadows. Deserves a big shout out because, you know, behind all of this is leadership. Anton likes to say beds of many flavors. This is leadership of many levels. And so their leadership, her leadership specifically, I see the other people up there in blue shirts, they're the people going to make the magic happen. You know, and maybe magic's the wrong word, but to get us the results we're looking for, the effectiveness and success of these treatments along with, so I just can't thank them enough for all the kind of work that they do because it takes a lot of this to make it happen. So, anything else for anybody? Thank you all. No. Yes, sir.
I was just wondering, what are the initiatives to combat the rise in COVID cases here at the center amongst the homeless population in general?
Well, since I'm not a doctor, I'll turn to somebody here. I could give you my interpretation of that, but I think Ian would be better. Go ahead.
So I know the rise in COVID, everybody's been out there, and again, we just encourage again to have safe practice by either wearing a mask, washing your hands, practice the distancing if you know it. Just like the common cold, just like the flu, again, if you're, for people that are out there in the public, stay home, don't go to work. If you're sick, you're sick. As far as inside the facility, to ensure that we're not going to have any COVID cases or any spread of it, we make sure that there's gloves changed, each individual. They're not in cross interaction. So we want to ensure there's always things, everything is being wiped down and so forth. Does that answer your question? Okay.
One more time. I was going to say, I'm hoping that you folks, this is a good story. This is a good story, okay? And I'm going to tell you that as somebody who spent a lot of years in media. This story is about all the right stuff. This is about providing hope in our community for people who are not homeless, people who sit there and go, can't somebody do something about that? You know, when you take our homeless population in the aggregate, it represents far less than even 1% of our total population, yet it's on the minds of everybody who lives here. So this is about attacking that in a very positive, constructive way. And so I'm really proud of it, and I just want to make sure you understand. We take this most seriously. Okay? Thank you.